basically, we're going to go through the objectives real quick, and then I'll give you guys a breakdown of what to expect, right? So first of all, for those who are new to fascial system or myofascial system or need some refresher, we're going to talk a little bit in detail about myofascial and fascial systems. We're going to talk about the pathology and the differential diagnoses around myofascial pain, like what causes it. Then we're going to talk about, it should be lower extremity myofascial chains. We're going to identify those chains, and I have mentioned the upper extremity chains as well in this webinar, because there needs to be a certain circle of continuum and completion. We're going to look into case studies, research articles, evaluation, treatment strategies, and so on. So basically, we're going to start right from the cellular level, and we're going to end right at the treatment level. So the way I design my handouts, I do try to make sure that I want my attendees to, or I want my learners to be present, and I want you guys to listen and interact. And that's why I provide a lot of written content, so you guys are not busy writing, because research says that 80% of the learning is done in the first time around that you're listening to a live instructor. So I just want to make sure that everybody asks and absorbs as you guys go along with me. And if any questions, pop them into Q&A. So we've got two buttons on your toolbar. One is a chat button, and then there's a Q&A button. So when you see the chat button, that button I would like to use for the questions that I ask, whereas the Q&A button I would like is a questions for you guys to ask me, so that I don't lose your question in those comments up there. Okay, so let's move on. So the first things first, we're going to go through the anatomy. We're going to talk about, we're going to identify the different myofascial chains, and then we're going to talk about treatment strategy. So three main parts to this. Somewhere along the way, we'll take a break. Now, those who have attended my upper extremity